Bismillahirrahmanirrahim. Our lecture today is about antihypertensive drugs. As we know, hypertension is one of the common diseases affecting human beings. And the blood pressure is affecting approximately 15% of the populations of the United States, for example, i.e. about 60 million people. So hypertension means elevated blood pressure. Although many of these individuals have no symptoms, so chronic hypertension, either systolic or diastolic, can lead to certain complications. So what are the complications of elevated blood pressure? First, cerebrovascular accident, means strokes. Second, congestive heart failure. Third, myocardial infarction. And lastly, renal damage, for example, chronic renal failure. So the incidence of morbidity and mortality significantly decreases when hypertension is diagnosed early and is properly treated. So when diagnosed early and treated properly, this leads to decrease these complications. So, how classify blood pressure? When we consider this patient or this person has a blood pressure. So, blood pressure is classified as the following: systolic, diastolic. Consider a person or a patient normal blood pressure when the systolic is less than 120 and diastolic less than 80. We consider the patient a pre-hypertension when the systolic between 120 to 139 or when the diastolic between 80 to 89. Stage 1 hypertension when the systolic blood pressure between 140 to 159 or when the diastolic between 90 to 93. And consider the patient stage 2 hypertension when the systolic is more than 160 and the diastolic more than or equal 100. When the systolic more than or equal 160 and the diastolic more than or equal 100. This is considered stage 2 hypertension. So have to have know the normal hypertension and have to have know the patient who pre-hypertension, whom stage 1 hypertension, and those whom stage 2 hypertension, which is considered the severe one. So what are the major factors influencing blood pressure? So have to have know the factor that influencing blood pressure and then control these factors in order to control blood pressure. So arterial blood pressure or arterial blood pressure is controlled by two elements. First, cardiac output. Second, peripheral resistance. The peripheral resistance, of course, controlled by what? By arterial tone. So any drugs or any medicine that decrease the arterial tones will lead to decreased peripheral resistance and subsequently decrease arterial blood pressure. The cardiac output, of course, controlled by heart rate, cardiac contractility, filling pressure. So any medicine or any drugs that control these factors will lead to the control or decrease the cardiac output and of course decrease arterial blood pressure. The filling pressure controlled by blood volume and by venous tone. So any drugs or any substance that lead to the decrease of blood volume or affecting the venous tone will lead to the decreased filling pressure and subsequently decreased cardiac output and lastly decreased blood pressure. These are the major factors influencing blood pressure. So what are our targets for the control of blood pressure? We have a patient with hypertension, whether stage 1 or stage 2 or pre-hypertension. What is our goals? What is our aim to the treatment? What is the target? So the British Hypertension Society guidelines require that antihypertensive drug therapy be initiated when? First, when the sustained blood pressure exceeds 160 over 100 millimeter mercury. This is the first target. When, this is the first indication, when the blood pressure exceeds or more than 160 or 100 millimeter mercury, or when the blood pressure is in the range of 140 to 59 systolic over 90 to 99 diastolic millimeter mercury, and there is evidence of target organ damage like cardiovascular disease or a 10-year cardiovascular risk greater than 20%. Other indication for diabetics, when blood pressure exceeds 140 over 90. So the threshold is lower than in other patient, another person without diabetes. In diabetics, our target have to have decreased blood pressure. When the blood pressure is 140 over 90, have to have control. And this differs from the other healthy patient. So the optimal target is to the lower blood pressure to 140 over 140, sorry, to 140 over 85 millimeter mercury. This is our target. In all patients except those with renal impairment, diabetics, or established cardiovascular disease, where there is a lower target of less than 130 over 80 millimeter mercury. So, what are the principles of antihypertensive therapy? Before starting drugs to control our hypertension, we have to have follow general measures which may be sufficient to control mild cases of hypertension. So what are these general measures? First of all, obesity, have to have control or reduce obesity. Second, alcohol, have to have control. Smoking, stop it. Diet, reduction in fat content, increase in fruits, vegetables, and fibers. And there is additional benefit for reducing intake of salt, less than 6, and avoidance of highly salted and omission of added salt from freshly prepared food. So very important things is a reduction of the salt intake. So reduction in fat content, increase in fruits, vegetable, and fiber, and reducing intake of salt. Other general measures include relaxation therapy and work considering for highly motivation border or highly motivated borderline patient. So obesity, alcohol, smoking, diet, relaxation. So drug therapy. Our subject or our lecture today is drug therapy. How drugs act to control hypertension. As I mentioned in the slides, factors influencing the control of hypertension. As I mentioned, peripheral resistance, cardiac output, and their factors that control of these two parameters. So we have to consider the following relationship. Blood pressure is equal to the cardiac output multiplying peripheral resistance. So any factor or any drugs, any substance control cardiac output will control blood pressure. Control peripheral resistance will control the blood pressure. Decrease cardiac output, decrease peripheral resistance will lead to the decreased blood pressure. So how drugs lower blood pressure? First, dilatation of arteriolar resistance vessel. This is the first mechanism. Second, dilatation of venous capacitance vessel. This is the second mechanism. Third, reduction of cardiac contractility and heart rate. And of course, this controls the cardiac output. The first two, resistance, dilatation of arterial resistance vessel, dilatation of venous capacitance vessel lead to the decreased peripheral resistance, while reduction of cardiac contractility and heart rate lead to the decreased cardiac output. Depletion of vital sodium. This is the fourth mechanism by which the drugs can lower blood pressure. So, what are the drugs used in hypertension? First group of the drugs, diuretics. Today we'll discuss some of these diuretics because Dr. Rasha will discuss diuretics in details in separate lectures. Now we'll give you highlights about some diuretics used for control of hypertension. So diuretics. The most common diuretics used for the control of hypertension is the thiazide group. They cause an initial loss of sodium with parallel contractions of blood vessel, with a parallel contractions of the blood and extracellular fluid volume. Why? Because lead to initial loss of sodium. The effect may reach 10% of the total body sodium, but it is not maintained. This is the actions of thiazide diuretics: sodium and water retention, decreased sodium and water retention. This will lead to the decreased blood volume, and this of course lead to the decreased cardiac output. Other mechanism of thiazide diuretics by long-standing use lead to the decreased peripheral resistance, because of decreased the vasoconstriction capacity of certain substance, and this of course lead to the decrease in the blood pressure. This is the mechanism of thiazide diuretics. Although this hypersensitivity may be a consequence of sodium depletion, thiazides are generally more effective antihypertensive agent than loop diuretics. So this is very important characteristics of thiazide, that the thiazides are generally more efficient or more effective antihypertensive agent than loop diuretics. Maximal effect on blood pressure is delayed for several weeks. The maximum effect on blood pressure is delayed for several weeks. What about side effects of thiazide? First, hypokalemia and hyperuricemia in about 70% of patients, and hypoglycemia in about 10% of patients. So hypokalemia, hyperuricemia in about 70%, hypoglycemia in about 10%. Acute gout attacks may be triggered due to the increase of hyperuricemia. As you know, the gout is deposition of uric acid in the joints. Hypomagnesemia may also occur in concomitant with hypokalemia, hypomagnesemia. The incidence of side effects is reduced when employing low dose of diuretics, about 6.25 to 25 mg per day of hydrochlorothiazide. The characteristic reduction in renal calcium excretion induced by thiazide may in long-term therapy also reduce the occurrence of hip fracture in older patients. This is very important benefit, that the characteristic reduction in renal calcium excretion which is induced by thiazide may in long-term therapy also reduce the occurrence of hip fracture in older patients, and this is one of the benefits of, and this benefit especially in women with post-menopausal osteoporosis. This will decrease the incidence of hip fractures, especially in post-menopausal osteoporosis, due to the reduction in renal excretion of calcium by thiazide. This is one of the benefits of the thiazide. Thank you very much.